and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, this is one we've gotten a few requests for.
Right.
And it's ischial bursitis. They also sometimes talk about what they call a high hamstring injury or high hamstring tendinopathy. And we're going to discuss this, what these things are. But
yeah, we've got a lot of big words going around here. We better clarify it for everyone.
And basically what it's when you're getting pain on what they call the sits bones. Do you want to show the sits bones on this, Brad?
They call them the sits bones because you sit on them.
Right, exactly.
It's as simple as that. When you sit down on a hard surface, you can feel
that bone, those bones underneath there.
Especially if it's a concrete surface.
Right, or bleachers.
Sure, and if you look at the pelvis, it's your ischial bursitis, they call them right here.
You want to take it up there, Brad?
Sure. Here. Oh, too close. How's that?
Don't get too close, you break the camera.
Now, there's like protuberances, they call them, and actually there is your hamstrings connect up to the sits bones.
Yeah, we're going to show that right on here.
And you'll see how this all connects together.
So the reason why these are often mistaken for each other, they both originate in the same spot on those sits bones.
Sure.
So the bursa is a fluid-filled sac that actually is underneath the hamstring tendon.
Right,
and,
so it lubricates the tendon so it doesn't wear out.
Exactly. So that is indicated by the blue here. That's the fluid-filled sac bursa. Well, the hamstring, the hamstrings also attach to this area, and some go to the one side and some go to the other side.
Right.
But you can see they run right along in here, and they help bend the knee like this.
Right. It's one of those muscles that's kind of complicated because it crosses two joints. It crosses the knee and the hip. And so it's hard to say exactly what it does because it's a complicated...
right, it extends the leg too.
The biomechanics of it is something you can study for a long time.
So, by the way, Brad, before we go any further, if you haven't already, I know many of you are new to our channel, please take just a second to subscribe to us. We got the little button down here on the screen. We upload a video every day, and they are all on things like this, how to help you stay healthy and fit and pain-free.
Exactly. Carry on.
All right. The big thing first you're going to want to do, Brad, I think in my mind, is determine which one do you have.
Right.
Is it a hamstring problem or is it a bursitis problem?
Sure.
So let's first go by your history. If you're an athletic person and you were doing some squats or you were doing some hill workout, some speed workout,
right.
I'm going to bet my money more now it's on a hamstring injury.
Right.
Because the guy that just contacted us, he thought it was ischial bursitis, but he goes, I was squatting and I did this. So I think, I'm going to right away say, I think it's a high hamstring tendinopathy. If you sit a lot and you don't do anything athletic, well, then I'm gonna say it's more likely the bursitis.
Right, right.
Especially you're an accountant or something like that, and
you're
sit all
sitting
day.
on it. You don't get up and move very much, so the circulation is depleted and it's compromised. It's more at risk for this kind of injury.
A couple things you can do, Brad. A couple tests you can do. If it tends to be a hamstring, if you do something like this, put your foot up on a chair like this and lean forward, and that makes it worse. I'm leaning more towards a hamstring tendinopathy.
Sure.
Then. You can also lay down like this, Brad, and you can even have somebody lift it up for you.
Yep.
And if that makes it worse, again, that you're stretching the hamstring. Now, while that person's in that position too, you can also push down.
Resistance.
Yep. And if it hurts when he's providing the resistance, again, more likely to be hamstring.
Right.
So
these can be tricky to rule out one way or another. So that's why we keep saying more likely. We're not going to say for sure.
It is very difficult. It fools many people,
right.
Many professionals. So, all right, let's say we decided that we think it's the bursitis.
Sure.
The first thing you're going to try with that is you're going to want to put some ice on it.
Yep.
I mean, you're going to want to ice it down.
You can simply sit on a cold pack that's a soft.
Or you can lay down on your back and put a cold pack on there too that way.
And it should feel good. It should give you some relief.
You're trying to get some of the stresses off that burst to let it calm down. So the other thing you can do is when you're sitting, and a lot of you are having pain with sitting, is to take a pillow and fold it like this. And you're going to put the pillow under the meaty part of your thighs like this.
Right.
So now the sits bones are kind of hanging out there. There's really not any stress on them. And I can sit like this, a little bit of a balancing act,
sure.
but it's taking the stress off of it. I've had one person that contacted me, Brad, that he was all worried about being on a plane, and he goes, it worked beautifully.
Sure.
He just took a couple of pillows from the plane and put them forward, and
Right.
he was able to sit.
It's just a matter of where you change the pressure point.
The other thing you may try, I mean, you may need to get an injection.
Sure.
That's just one of those things that,
If you tried all these things and it's so bad you can hardly work, I mean, you got to get back to function. You got to get to work.
one thing you want to make sure you're not doing on this, Brad, is I wouldn't do the foam roller. I mean, if you take a foam roller and you roll right over that bursa, you're just going to irritate it.
Yeah,
So-
and it's going to hurt.
Right.
It's going to give you some pretty nasty pain, so listen to your body on that.
That might be okay for if it's a hamstring problem,
Right.
but it's not going to help with the bursa. It's
Yeah,
gonna-
and that's where you have to be careful.
So, all right, let's say we believe now that it's a hamstring injury. It's a what they call tendinopathy. Tendinopathy means it could be a tendinitis or a tendinosis. I know those are big words. Tendinitis means it's inflamed.
Right.
It's fired up. And in that case, you could also ice on that case.
Yep.
I mean, it certainly wouldn't hurt to ice it in most cases.
Right,
Yeah.
you're not going to do any damage with a cold pack.
Now, if it's been there for a long time and it's more chronic, Brad, it's probably not a tendinitis. It's not that anymore. Now it's a tendinosis, which means it's a chronic thing that it's become deteriorated. There's some tears in there. It's not. It doesn't have the strength it had before. So we're going to want to do some strengthening and some cross fiber to it.
Right, cross fiber massage.
Yeah. So with cross fiber massage, what we're doing is this is very difficult to do on this particular area, by the way, but you're going to take your fingers and you're going to rub the bone right below the bone here, and you're going to go across like this really deep, and you're trying to break up the scar tissue, and you're trying to get a little more blood flow to the area.
Right, right. So again, this is why it's so difficult to determine whether it can be the bursitis or the tendinitis or tendinopathy, because it's right the tendon part is right connecting to the bone. I mean, they're, a millimeter apart, and, so.
But that's a good point, though, Brad, is that if you do the cross fiber and it starts getting worse, it might be bursitis.
Right.
I mean, because cross fiber will feel good on a hamstring after a few, maybe 30 to 40 seconds.
Sure.
It should start to calm down.
Yep.
But on anything else, on a bursitis, it's going to hurt. The one way to do this cross fiber really is really to use, like we often recommend using the Pure Wave massager. I'll put up a video on a link to this
Right.
here. The reason is nobody can do this for any length of time. It's just so fatiguing.
On your your fingers.
If you're laying down and you're putting your foot up, like this, and you're going like this, I mean, you can try it.
Sure.
But I mean, they're recommending like 15 minutes, Brad.
Right, Syriax, says that
Yeah.
usually 2 to 3, 4 minutes, and your fingers are tired, and they could benefit from more of that cross-friction massage.
Yeah, and if you don't want to put out money for a Pure Wave, start this, just do a couple minutes,
Yep.
and then do some of the strengthening, and we'll.
Right.
But the Pure Wave, you can just relax and watch TV, and you can get in there deep,
Yep.
and it really works out well.
It is a nice device. It reciprocates versus vibrating, horizontally.
It has percussion,
Sure.
like this, so it really, it's a well-built machine, and we really are big fans of it. So, all right. The thing that we have found, Brad, the studies have shown that has really helped on this type of condition, though, is eccentric strengthening.
Eccentric. So in other words, the muscle is getting longer with resistance, which
Right.
sounds kind of complicated.
Well, I'll show one, easy one to do, Brad, is just to do bridging. So when I bridge up like this, now the hamstring is lengthening, but it's also strengthening.
Sure.
So you can just start off doing some sets like this. I don't want you to increase the pain. It's okay if you bump up against the pain, you just slightly feel it, but I don't want you doing these and going, oh, and it flares it up.
Right,
And I
right.
know this again from treating it with my wife, and she was able to do these.
Sure.
And you can also make them harder by putting the feet out further,
Oh yeah,
and you can also go 1 foot. Once you start.
that's quite a bit more aggressive.
Yeah, that's a lot more aggressive. But these are the things you can start without using what the next thing is. We're going to use a ball.
Sure.
Okay.
Get the red ball, not the blue
Yeah.
ball, Bob.
These are, if you have this, I would invest in a ball, Brad.
Right.
Because these are what are helping my wife by far.
Yeah, this is a superior way to
Yeah.
work the hamstrings. I
So
believe.
what she does is she rolls it in like this without putting any stress on the hamstring, and then she lifts up and rolls it out.
So as she's rolling out, that's the eccentric.
That's the eccentric. So she goes up, rolls it out. And she does a set of 10.
Then she puts her butt down and
Yep.
rolls it back in easily.
Yep, exactly. This is just a beautiful way to get eccentric
Right.
strengthening. And I've become a big fan of that because, Brad, I was having a tendonitis up in here, and I did eccentric strengthening on there. It takes a while. I mean, I told her it may take her a couple months
Right.
if you have a chronic condition. If it's acute, I don't think it'd take that long.
But she's been dealing with this hamstring issue
Oh,
for years.
Years, yep. So then you can also do the one-legged ones, Brad, if that gets to be too easy.
Yeah. So he's crossing his leg. The foot on the bottom is the one that's doing
Do
most
all the
of
work, and then you also go like this, don't you, Brad?
If you're doing that, you probably don't have a problem.
Yeah, it's probably already starting to go
Feeling
away.
pretty good.
So that is what I would recommend, Brad, the eccentric strengthening over anything if you have the hamstring problem, and I hope that helps.
Oh, it will help. So continue to enjoy life and have fun. And if you get that broken heart, continue to watch us because sooner or later we are going to
Remember, we can fix just about anything
but that broken heart. But not long. We'll get her figured out.
All right, thanks.